All right, so our next speaker up is Kristy Deep. Kristy is an associate professor of medicine at the University of Kentucky and is the residency program director there. And
I want to make sure everybody has one of these handouts, so we'll be using that as we talk about formative feedback, which I'm going to put in this model of clinical coaching. So coaching involves a couple of discrete clinical skills, all geared toward this notion of delivering formative feedback in the moment. Ryan's going to talk with us a little bit later about kind of those higher, loftier notions of evaluation, assessment, kind of end of the rotation feedback. So what I really want to focus on is helping our learners get better with a very discrete clinical skill. We're going to talk about how to appraise their performance, kind of produce this formative feedback in our mind, formative feedback that's going to get them to that very next developmental step, and then how to formulate those coaching comments in an ask-tell-ask kind of framework. So this is from a great article by Dr. Rangachari, Laurel Brown, and others. It was published in Medical Teacher. And they really show this kind of coaching cycle model with these 5 discrete steps. Performance observation that's kind of informed by our understanding of milestones, EPAs, how our learners are gaining these clinical skills. What path do they follow? We assess them based on our mental model, and then we deliver this formative feedback. We're not going to touch on goal setting and facilitated practice today. We're all going to get to this formative feedback step. And we're going to do that in the context of a case. So as I mentioned, put on your coach hat. So I'm from Kentucky. Any basketball fans in the room, right? So my season tickets are right across Rupp Arena from Coach Cal. And let me tell you, he is coaching all the time, often with colorful language that we may not necessarily use in the wards or clinic. But think about how, if you're a musician, a musical coach, or a sports coach, and many of our learners have had coaches in their life prior to medicine. So let's put them in that framework where they are going to be open and accepting of someone watching them do something and helping them do it better. That's their goal. So let's practice coaching this learner and giving them some specific formative feedback. So we have a case of Mrs. Wall. She's 18 and has come into the emergency room for abdominal pain. Now, the clinical skill we're going to be focusing on today is gathering and organizing information in a hypothesis-driven way. Now, as I was walking around the room and passing out handouts, I saw the people's badges. Here were some cardiologists, there's some nephrologists, there's some pediatricians. So I want you to put on your medical student hat and think about an 18-year-old woman with lower abdominal pain. Even if this isn't your everyday world, think about those few things, differential diagnosis of what she might have. All right, and now let's listen to Nick. Miss Wall, he's very enthusiastic and eager here as he's telling you his presentation. So Miss Wall, she's 18, she came to the emergency room for abdominal pain. She says it's worse down low, started about 3 days ago. It's an 8 out of 10. She has no sick contacts, she's not had any recent travel. She's up to date on all of her immunizations. She says nothing makes it better, tried some Tylenol a few times, but that hasn't really helped. She's not eating any new weird foods, anything spicy or fatty. Moving around makes it worse, and she says it's this deep squeezing pain. She has associated nausea, but no vomiting, no diarrhea. Past medical history, she has anxiety, she takes Zoloft. She's a freshman here at UK, lives in the dorm. She's sexually active with a partner, doesn't smoke, drink, or do drugs. Family history, she says her parents are healthy, grandma died of breast cancer, 2 of her grandfathers had a heart attack. All right, now, take a couple minutes, especially for those of us who might not necessarily see 18-year-olds with abdominal pain all that often, and read the presentation that learner Pam would do there. Take a minute and read, and then we're going to kind of compare and contrast in our mind what a more proficient learner would look like versus this novice, and that'll help us prepare our coaching comments for him. So, read learner 2. And then, so now that you've got these 2 learners in mind, let's look at what the developmental milestone on gathering history and prioritizing in a hypothesis-driven way. And reflect on, well, how well did this learner do that? And then what can I do to coach them to get to the next level? So what do you think about Nick? When you observed Nick, when you listened to Nick, think about what are you listening for to see where he is on this developmental trajectory? What are the key differentiators between Nick and Pam as they're progressing? And then what are some of the common missteps? So skill 1, what are your observations about Nick's presentation? Yeah.
He didn't start with an illness script like Pam did.
Right. So he doesn't have an illness script. Great. So if we tell Nick he doesn't have an illness script, wouldn't know what that means, right? So we're going to have to, as we prepare to coach him, we're going to have to break it down and get real specific with what we want Nick to do to get to be more like Pam. But that illness, so what about the content? What about the information that he has here?
He's not thinking about potential causes of abdominal pain like Pam is when she takes.
Right. So it isn't clear to me that Nick has a differential diagnosis for abdominal pain in an 18-year-old woman that he's asking targeted questions to drive to. It looks like Nick is doing, as Cal said, kind of that H&P rote question that we teach them to do, all 150 checklist items when they interview their standardized patients. So he seems to have this rote, I'm going to ask these questions. Great. What else? Yeah.
Some of the organization of the presentation is a little bit off. It doesn't seem like a linear thought process.
Great. So there's some organization issues, right? So one of the things I noticed in the second sentence, you're telling me she's up to date on all immunizations, but yet it takes us to get to the last sentence to hear that it's a deep squeezing pain. So some of that organization and prioritization. Great. Any other observations about Nick's history taking, organization, or prioritization? All right, so now you've made some observations. Observation and assessment is kind of a two-way street. They're kind of going to go back and forth, right? So, but let's really articulate, what do I want to reinforce about Nick's, what skills do I want to reinforce so that Nick knows I did this right and I need to keep doing it that way. So that's what I'm going to reinforce versus what do I need to correct. So in general, we only want to reinforce those fully mastered skills or things that they're doing a little bit of that we need them to do more of, right? Versus what to correct, anything that's done incorrectly or below the developmental level that we would expect a learner at their stage to be at. And then sometimes I think about, well, what's holding them back? You know, we heard that it's a little disorganized, it doesn't seem to be hypothesis driven. Maybe that's the main thing that's holding him back from really taking a better history. So, what are we going to reinforce? What are those top couple things you're going to pick?
I think he's working towards like hitting all those cardinal features of the problem.
Yeah, the old CARTS or L, location, quality, severity, alleviating, exacerbating, right? I heard a lot of those in there. He asked those good kind of templated questions. Great, so we can reinforce that. What else might you want to reinforce?
Simple as it sounds, he actually collected a social history.
Exactly, right? Like, how many times have we worked with early learners and they're telling you exam and history, or they leave out past medical history altogether? So it's complete-ish and organized. There is HPI, past medical history, social history, family history. Those big chunks are all there. So we've got some things that we can reinforce so he knows, okay, I did that right, I need to keep doing it that way. Great. Now what about correct? Yeah.
There are a lot of pertinent negatives he did not address.
Yeah, so there's a paucity of pertinent negatives, right? We've got a couple pertinent positives maybe, but he asked some, abdominal pain. He asked about nausea, vomiting, GI complaints, so that was good. But there are a lot of other kind of pertinent, maybe differential diagnosis specific things that he didn't ask. So that's probably where we want to drive most of our corrective coaching comments here. So now, what makes coaching comments a little different than kind of this formal feedback? And the way I think about it is we have in mind this goal for our learners. This is an actualized skill. This is them doing it as well as we can do it, right? But they are not there yet. Some of them are far, far from there. There's a big gap. If we point out the whole gap to our learner, what's going to happen? They're either demoralized, and we're not prioritizing. What's that next step that you need to work on? So think about building it layer on layer. Do this next, do that next. Okay, then 2 days later, I'm going to hear another presentation, see another patient, add those layers. Some people frame it as this idea of nudging our learners out of the comfort zone into the learning zone, but avoiding the panic zone, right? We don't want to demoralize them. I'm from Kentucky. We have a lot of caves. I love them. So I think about it as stalagmites. Stalagmites, if you don't remember your 5th grade science, are the ones that start on the bottom and something is dripping. This calcium carbonate is dripping from the ceiling and adding that next little layer. So think about your learners as these fragile stalagmites and drip that next little layer on top of them. So now, mind you, this is on the fly. This is mental. So this isn't sitting down. Cal gave a great suggestion. Keep a notebook in your pocket, take down comments, write things down for more kind of summative feedback. Here in the context of clinical skills coaching, we're only talking about in the moment. We're talking about a synthesized, organized history. What are those key things that I want to give you feedback about now? So, how does this too often happen? On the right, your presentation was incomplete. You missed a lot of important details. Be more thorough next time. Is that going to help Nick get better? He clearly doesn't know how to be thorough, right? Because clearly he wants to do a good job. So, how can we frame what we tell him to make it stick? So I think about the what, why, and how. What specific behaviors do we want Nick to do differently next? What specific behaviors can be improved, and why? And then the how, next time do it this way. So think about the what, the why, and the how. So on your sheet, take a moment, and if you flip over to the back side, there's the skill 3, giving formative feedback. So let's talk about this ask, tell, ask model. The idea is that by first asking the learner to kind of self-assess and to reflect, that you prime them for being a little more engaged, receptive, listening to what you're going to tell them with your coaching comments. So ask, how do you think that it went? What would you do differently next time? Something like that. Next, tell. Tell them the what specific thing they need to improve on and why. And then ask, how will you do it different next time? And then maybe that's where you then get to tell them how to do it better next time or differently next time. So take a moment before I give you the answers and jot down some thoughts about if you were right there on the wards or in the emergency room with Nick, thinking about those reinforcing feedback I want to give him. How would you do your ask, tell, ask? Come up with some ideas and I'll steal them. All right. Who's got a good ask for Nick? How can we ask Nick to kind of self-assess? Prime him for getting some feedback here. Yeah.
How well do you think that your history helps us arrive at a diagnosis and plan for this patient?
Great example of a specific ask. Because and let's think about how that's going to give him a lot more. It's going to get him targeted on the feedback he's about to give, right? Versus how did you do? How well do you think that went? Well, I think I did pretty good, right? But I love that idea of getting him to the specific skill that we're coaching on in this session. Super. Any other ideas for an ask? Go ahead.
Something like, before you ask your first question, what were the differentials?
Yeah, so priming him that you're thinking about this differential diagnosis-driven, hypothesis-driven thing. Nick, depending on his stage of training, may or may not be able to come up with a lot of good ones, but I recently took up golf. I don't know if there's any golfers in the room. Sometimes my learners play golf. Sometimes it doesn't work. But all right, so say you get a mulligan. What else would you want to ask this lady? Say you could go back. Because a lot of times our learners, as they are saying a presentation or writing their note, they realize, oh, there are some important things that I left out. So if you ask, well, if you could go back, what other questions might you want to ask this patient? If he comes up with all those right questions, then you're going to save yourself time in your coaching because looks like he already knows some of those things, right? So prime him, ask. Great. Now the tell. What are you going to tell him? What discrete thing do you want him to work on? Sometimes it's good to make the tell very behavioral and an I statement. So instead of you did it wrong or you left out all these important details, I didn't hear whether her pain was on one side or diffuse. That might be an example. It sounds like, or I didn't catch whether she's using anything for contraception. It can be specific things like that that are guiding the differential diagnosis. And the tell, the what, is going to be very different depending on what kind of skill you're focusing on. So for instance, if you're coaching on bedside communication, I might say, well, I noticed that the patient wasn't making eye contact with you when you were talking, to use one of Cal's examples. Or, I heard that, I heard the way you asked that nurse's question, and I'm worried, or answered that nurse's question, and I'm worried that there was a miscommunication there. So try to be that specific, and the I statements. I observed, or I didn't hear, or I saw, whatever. And then the why. Why is that important? It's important to know whether the pain is unilateral or bilateral when I'm generating a differential diagnosis for a young woman with abdominal pain. And then finally, the ask, how will you do it different next time? Now, sometimes our learners, who are very good at self-assessment and kind of know where they need to be, can come up with that on their own. Oh yeah, next time I'll make sure I ask about this, that, and the other. Sometimes you have to follow your ask with another tell. And I've got some magic words, I call them magic words down there at the bottom of your page, that are a great way to deliver that tell. Next time, try this. Instead of this, I do this. Sometimes I try to kneel down at the patient's level and touch them on the shoulder so that I really make sure they're engaged when I'm talking with them to get them to make eye contact. So what might be a tell that you would give Nick about how to get the differential diagnosis, hypothesis-driven history next time? What can we tell him?
Sometimes Nick knows.
Yeah.
I'm sort of envisioning a guy where I'd say, well, what do you think's going on? He'd say, well, I think she's either pregnant or has a UTI. I'd be like, then why are you telling me all this other stuff? Why don't we, you already know what to do. Stuff, you have to drop all the schema that was told you in medical school to come up with this list of 100 things.
Great.
Spicy food. You know it's not important.
Yeah, don't tell me immunizations. I don't know any immunization against abdominal pain. I don't know. So great. So they might be able to self-correct. What if they can't? What might be a suggestion that we can make to Nick to help him get to this differential diagnosis-driven questions? One I came up with was, think about the way we do this. Okay, next time you see a patient, I want you to pause, look at their chief complaint, think about their age and gender, and write down 3 things it could be. And then I want you to write 3 questions that will tease out, is it this, this, or this? A very concrete, very specific tell in this circumstance. Any questions about the ask, tell, ask? And one of the things I want to come back to Cal's presentation on about slow walkers, right? So I am a super fast walker and make my learners walk fast with me. But this kind of coaching, I do walk into the elevator, between the rooms, and when you have set that learning environment that I am going to coach everybody on clinical skills, this isn't threatening, it's low stakes. So I do it in front of the whole team. I don't feel the need to pull them aside or do whatever. It's, hey, I saw this is what you did great, next time try it this way. I heard this word, I don't understand that word, how's another way you could say it? Okay, yeah, exacerbate, not a good word, try this instead. It's that in the minute, walking room to room, kind of coaching comments that can be helpful. So what do we learn? We're going to observe with intent, use your milestones if you have them, or just kind of your own mental model of how learners are developing these skills. Decide what to enforce, what to correct, and drip on just that very next little layer for their growth. And then coaching when the ask, tell, ask. What went well? What did you do well? This is what you need to do different next time, and here's how to do it different next time. All right. Any questions about coaching? All right, I expect many Coach Cals out there in our academic medical centers across the southern region. No 4-letter words.